I've got you under my skin. I've got you deep in the heart of me.
All right, welcome back. You know, during the summer, we're always thinking, oh, sunscreen, sunscreen. It makes sense in the summer, but what happens during these winter months? Well, here to talk about this, Dr. Richard Chaffoo. Did I say that right? He's from the La Jolla Plastic Surgery and Dermatology facility to talk about what we should be thinking about, especially on a day like today.
Sure, because we think in the wintertime we don't need a sunscreen. We're safe, but actually we're not safe because the ultraviolet rays from the sun, the harmful rays that cause premature aging, wrinkles, and cancer actually penetrate through the cloud layers. And so we're fooled into thinking we don't need to use a sunscreen. The other thing, this time of the year, because we're doing a lot of outdoor sports, we're going to Big Bear or Mammoth, we're out skiing and snowboarding, we're getting those reflected ultraviolet rays off the surface of the snow. And when we're at a higher elevation, which we are, of course, we're in the mountains, that protective layer called the ozone thins out and allows more of those harmful ultraviolet rays to penetrate through the atmosphere. So
when we talk about sunscreen, there are some specific things we need to be looking for when we go out and buy the sunscreen.
Exactly.
What is it?
So, well, the take-home message is you want to have a sunscreen that covers both the UVA and UVB. So you want broad spectrum coverage. And then you want to look for something, we like mineral products. For example, zinc oxide and titanium dioxide are really two key mineral products that are great that block out virtually 100% of the ultraviolet rays. And you can look on those on packages and actually find those. The nice thing about using a mineral versus some of the chemicals, if you have sensitive skin or in children, they're less likely to cause a breakout or acne. If you have rosacea, you want to use something that's mild for the skin.
You see a lot of patients here in San Diego with skin cancer as a result of this. Let's talk about the fact that there are just a bigger, a more wide range of cases here because of our beautiful weather.
Exactly. And you know what we found is that the American Cancer Society has said that there are about 5 million new cases of skin cancer every year, and that the incidence of both what's called non-melanoma and the melanoma skin cancers has dramatically increased to where they say that maybe 1 in 55 people will get a melanoma in their lifetime. And especially here, as you said, when we're outside all the time, we're fooled into thinking that we're actually protected.
All right, so let's talk too, since you work at a plastic surgery place, you know, when the weather's like this outside, you know, our skin starts to get dry and you know, and you feel a little crackly happening. What do we do to help that?
So the big thing is moisturizers. You want to put a moisturizer on first thing in the morning. Very important. There are a number of different products. I like a product called Skin Medica, which has a nice moisturizing agent, but you want to hydrate your skin, especially this time of the year. We're indoors sometimes. We put the heat on. Dries the skin out more. We're taking a lot of showers, baths. Again, that takes away the natural oils. So as part of your daily skin regimen, you really want to use some sort of a moisturizing agent in your skin.
Now, when you go, because you know, you go to any Sephora, you go to, you know, Walgreens, you go anywhere, and there's a million different moisturizers. Are there certain ones or certain products that you should be looking out for, ingredients in those moisturizers?
Well, the most important thing you want to look for is something that's got a hydrating or moisturizing agent. You want to avoid chemicals. So it's not so much an exact agent like with the sunscreen, but you want to find something that is not particularly expensive that you can apply that easily goes on. You want to look for something what we call that's non-allergenic, non-comedogenic, which means you don't get whiteheads or blackheads, and look for something that's relatively grease-free.
Yeah, absolutely, because that's the last thing you want is the shiny thing to happen as well. All right, Doctor, all great information. Thank you so much for coming in this morning. All right, the 25th Annual Defense Trade Show here in San Diego. Obviously, we are a huge military town, so this whole thing fits together, and Ed Linderman is live there right now. Hey, Ed.